My name's Jayne Bressington. My daughter Eve is a paediatric GIST patient, and hopefully I can briefly give you, if you haven't heard about PAWS-GIST before, an introduction to how we started and what we're trying to achieve. Basically, it all started in 2010. I believe at that point that GIST Support UK were aware of 3 young people classified as paediatric GIST, and there were 2 families who unfortunately had diagnoses in 2010, and that was us and the Hebrideans. Basically Lee's daughter Pippa Hatch was also diagnosed just before. And both of us basically sought more information and help, and found it in the form of GIST Support UK, who were just a wonderful source of support and guidance. And they brought us together and introduced us to one of the other paediatric GIST patients, Stacey from Scotland, who I gather until the point that Pippa was diagnosed, thought she was the only paediatric GIST case in the UK. So we found comfort in finding each other. Ooh, don't know what happened then. Basically, to begin with, the doctors in Bristol hadn't seen GIST before in a child, and they pointed us at a group in America who have set up a paediatric and wild-type GIST clinic. They're based at the National Institutes of Health in Washington. So we went to see them, and they have a clinic twice a year for this group of patients, and they see 10 patients each time. And effectively they're gathering as much information as they possibly can from each group of patients, and trying to build up a study group effectively so that they can hopefully find a cure. But so they are reasonably advanced, but they don't yet have solutions that find the cure at the moment. So having come back from there and also met up with these other patients in the UK, we felt it was necessary to find specialists in the UK, because as we've moved on, we've discovered there are quite a lot of patients, even though it's rare, who fall into this group. And we believe there will be many more, but until mutational testing is standard, we don't know all the wild-type GIST patients, for example, that exist. And potentially there are other people who've been misdiagnosed and they have GIST, and then at some point they might actually be properly diagnosed. So obviously I've got a vested interest in this, because as far as I'm concerned, nothing matters apart from finding a cure for my daughter. So we wrote to as many doctors as we could find on the internet who had any mention of GIST as something they were interested in, and 11 responded saying that they were keen to help us. And one of those, I think if you came to the last meeting, you saw Dr. Balusu. He not only offered to help, he said he would like to lead our group. So that was really very exciting and encouraging when we received that sort of response. So PAWS-GIST was born officially in terms of a group of doctors meeting last November. I had a meeting in London to try and sort of agree. Oh, you won't be able to see that, but that's a sort of chart which basically shows there's a group of doctors, a group of patients and parents, and GIST Support UK, who effectively form this group. Our aims, obviously we want to try and galvanise some real concentrated effort on this group of patients. We want experts in any country that has expertise effectively, but so far it's the UK, USA and Europe, to pool and share knowledge. We want to be able to help conclude the most effective treatments and to improve life expectancy and quality of life, and ultimately to find a cure. So the actions we agreed in November to try and move forward were, first of all, to try and find all the UK PAWS-GIST patients. Currently, as Professor Judson says, that these cells are very difficult to grow. The tumours aren't available that often, and when they are, they're difficult to grow. Nobody has been successful in the world yet at growing a wild-type GIST cell line. So until they are, it's going to make research not perhaps move as quickly as it might. So we need to try and help get a situation where that can happen. We think it would be a good idea for doctors generally to have a sort of minimum data set so that they're more aware of the fact that this patient they're seeing who has come along with a lump might actually have something called GIST, because a lot of doctors don't realise that. We've heard this week of a patient in Northern Ireland who 17 months ago presented with a lump when she was pregnant and was told it was a hernia. It's now been diagnosed as a GIST, quite feasibly a paediatric or a wild type one. We want to support research. We want to get some research going. We want there to be a proper regime for human tissue management. You know, these tissues are rare. Let's do something meaningful with them. We'd like paediatric GIST patients to be included in clinical trials. At the moment, our daughters aren't eligible because they're not 18 or more. So I would like to think we could find a way for them to be in these clinical trials. And the more I become involved with the medical profession, I am totally in awe of all these people that do this work, but there do seem to be some barriers between certain groups of people, and I would like to think we can help to break down some barriers to mean that, you know, we all make progress together and there aren't any hindrances in the way. So results so far, we've found 28, actually it's 29 now, patients who fall into this category in the UK. That didn't take a huge amount of effort, and not all the people who we've written to have responded, because the question I'm asking, they can't always answer. They might know that they have 2 paediatric patients on their books, but when I'm asking how many wild type patients do you have, they don't know the answer because mutational testing hasn't happened. So we think there are, in this group of patients, a larger number. We don't know how many more, but a larger number. Results so far. My understanding is there is a move to get a national GIST register in place. I believe it's under construction, and I've heard this from Dr. Beluso and also Professor Judson's nodding. So that obviously will be really beneficial, because it will also help to presumably ultimately find more PAWS-GIST patients if we've got a proper register in place. Dr. Beluso went to the ASCO, which is a very, very significant cancer conference in America, and he then went to the 7th National Institutes of Health Paediatric and Wild Type GIST Clinic in June, and shadowed all the doctors that went there, and came back very fired up with enthusiasm for what they're doing out there. He agreed they are a wonderful selection of people that are working on this. They're very, very focused. But he also came back feeling that if we are to have any impact in this country on getting this initiative going properly, we do have to gain something called commissioning status. So we've been looking at how we might go about doing that, because until he'd actually said this, it wasn't a term I was particularly familiar with. We've come across a professor in Dublin, Professor Maureen O'Sullivan, who it turns out was actually at the NIH clinic when Eve and I went there. And the purpose for her being there was also to shadow what the doctors were doing there. And she's now started a paediatric and wild type GIST research project into, I think it's the SDH elements that Professor Judson was talking about. She's based in Dublin. And at the moment, I think most of the tissue samples that she's been using have been given to her by the Americans. So obviously, if we have tissue samples that we can somehow help her with finding, then that I think will benefit the research that she's doing. Obviously, we've got some key GIST clinicians working with us on this. And as an aside, obviously friends, family, relatives have been making every effort to raise funds for a project which is really to focus on getting some research projects going in this country. And we've raised, I think it's somewhere between 26 and 28,000 pounds since last June. Sorry, June 2010. So that's not an insignificant amount, but it is insignificant in terms of the amounts that will be required to get a research project going. So obviously any fundraising that any of you might be able to help us with will be very gratefully received, and we're obviously working on that non-stop. Earlier on I think it was last month, yes, last month, I attended the European Multidisciplinary Cancer Conference in Stockholm. I applied for a scholarship, as it's called, to afford for me to go there on behalf of PAWS-GIST, and was fortunately to be awarded that. And as a result of that, I believe it has widened our network in Europe. Basically, I was in a seminar which was talking about advances in cancer research, etc. And then the question came to the audience, where are we falling down? So I put my hand up and said, paediatric GIST and wild-type GIST, you know, where are the research projects going on in Europe? And I was told that there is a move to get some research going in this area in Europe, and was pointed at a Dr. Arnold Verschoor, who's based in Marseille. And subsequent to that, I've had an email dialogue with Dr. Verschoor, and he's very interested in the progress we're making with PAWS-GIST, and says he would like to meet so that hopefully we can pull together a wider patient population effectively, because in each country, for example, there are, I believe, something like 17 paediatric cases in France, 17 in Germany, 6 in Poland that I've been advised of. So collectively we form a much bigger group, and hopefully that way we can offer to any researchers, you know, a bigger population to work with. So looking forward, obviously this specialist commissioning, sorry, am I in the way of the screen? The specialist commissioning status that we talked about, I approached our local politician in Bristol, who's Steve Webb. He's the pensions minister. I went to one of his clinics and said I didn't want to be yet another sort of letter or email lost in a mass of other information that the health minister might receive. Could he help me to get a meeting so that we could discuss specialist commissioning status? So he's done what he said he would do, and we've had a letter back from Andrew Lansley, the health minister, saying that he wanted us to meet with Professor Sir Mike Richards to discuss what our plans are and how he might be able to help, and that's happening on the 27th of this month. So we have to keep our fingers crossed with that we present what we want in the right fashion, but I'm hoping he can help us. We are hoping to arrange a meeting with a team of doctors who are involved in novel drug development to explore in vitro research into PAWS-GIST, investigating target pathways and protocols, and how we can develop this UK clinic. Obviously we're quite ambitious with what we want to do, but while there's ambition on that side also, because we're a smaller group, in my mind, it should be easier because, you know, we've less things to actually put in place, and, you know, it's a smaller group, so it shouldn't be so difficult. Obviously, we're meeting with the European doctors, hopefully. If that doesn't happen in Berlin at the Spain conference, then we will organise that as a teleconference. But there's lots to do. I mean, we've been. It feels like we've been taking an eternity in my sort of time frames, because I've been sort of shouting about this since January 2010. I'm hoping that as a result of all this pushing, that at some point soon we're going to make some headway and actually get some things more positively in place. So this is where we are with PAWS-GIST. People are very interested to help, and if there's any assistance you can give us by at least spreading the word about PAWS-GIST, taking any of the leaflets from the back or any of the cards and giving them to your doctors locally and asking if they have any knowledge of wild type or GIST patients that they can contact us about. Or if you've got any really fit people that want to run marathons and haven't got a specific cause to do it for, then point them in our direction, and we'd be very happy to take any assistance they'd like to give us. And that's it. Thank you very much.